أبنائي وبناتي الدارسين للجراحة العامة. This is Dr. سعيد عبد الباقي Professor of General Surgery عين شمس University كايرو. الفيديو ده مراجعة للبريست عن طريق ال MCQ. True about breast carcinoma in men, estrogen receptor positive, commonly invasive lobular carcinoma, radiotherapy contraindicated due to close proximity to chest wall seen in young males. الترو هنا هيبقى ان هو estrogen receptor positive. الباقي بقى هتلاقيه untrue لان هو اللوبلر كارسينوما لا تحدث في الميل، لان الميل بريست doesn't contain lobules. اوكي. وراديوثيرابي كان بي given، وهو سين طبعا في السن بتاع 65 سنة، مش في اليانج ميل. What is true about male breast carcinoma? Gynecomastia is a predisposing factor, more common in right side. Tamoxifen is not given. No estrogen receptor presence. The true answer here is gynecomastia is a predisposing factor. As a matter of fact, it is found that 20% of males with breast carcinoma give a past history of gynecomastia. يبقى هي predisposing factor. هو طبعا more common on the left side not on the right side, and التموكسافين can be given لأن هو معظمه بيبقى ER positive. Okay. True about male breast cancer. Invasive lobular carcinoma is most common type. This is not true. زي ما قلنا مفيش lobular unit في الميل. ER is negative بيبقى هو positive. Seen in young males هو seen in old males. BRCA2 mutation is associated with increased risk. Yes, this is true. Okay, go for G. Which of the following is the treatment of choice for early breast cancer in a 30-year-old lady who is 4 months pregnant? This lady is pregnant and has early breast carcinoma. You should go for, yes, modified radical mastectomy. Go for D. Because in this trimester, you cannot give chemotherapy and you cannot give tamoxifen to a pregnant lady with breast cancer because it is not estrogen dependent in a pregnant lady, and like local wide excision is not an option because this breast conserving therapy necessitates giving radiation, which is not available in a pregnant lady. Okay, so go for modified radical mastectomy. Which of these operative steps is not done in modified radical mastectomy? Total mastectomy, axillary block dissection, removal of pectoralis major, removal of pectoralis minor. Go for C. We don't remove pectoralis major in modified radical mastectomy. Pectoralis major is removed in the old radical mastectomy of Holstead, okay? Not for modified radical mastectomy. 43-year-old lady present with a 5 centimeter lump in the right breast. 5 centimeter means T2 because T2 from 2 to 5, okay? With 3 centimeter node in the supraclavicular fossa. Supraclavicular fossa involvement means N3C, okay? Which of the following TNM stage she belongs to? هندور, look for something which is T2 N3. Of these, T2 N0 not correct, T1 not correct, T2 N3 M0 yes. Go for C. This is the correct TNM stage for this lady. Okay. TNM staging of breast carcinoma with positive bilateral supraclavicular lymph node. طالما طالما قال لك positive bilateral يعني opposite supraclavicular is involved, this means M stage metastasis. So go for yes D M1. Okay. Following are components of breast conserving therapy except we excise the tumor plus a rim of 1 centimeter of normal breast tissue, which is correct. Axillary block dissection, yes, we do axillary block dissection sometimes in breast conserving surgery. Routine removal of the skin over the tumor, no, we don't remove the skin routinely over the tumor in breast conserving therapy. Sentinel node biopsy in selected patient, yes, that's true. So the exception here is C, okay? Following are true for radiotherapy in carcinoma breast except it should be given after breast conserving therapy. Yes, that's true. Large tumors after surgery require radiotherapy. Yes, that's true. Extensive lymphovascular invasion is an indication. Yes. For example, after removal of lymph nodes in the axilla and the pathologist tells you that there is lymphovascular invasion extensively and there is also extra capsular invasion in axillary lymph nodes, this is an indication to give adjuvant radiotherapy. Radiotherapy is routinely given to axilla after a complete block dissection. No, this is the exception. This is wrong statement. After complete block dissection, you don't have to irradiate the axilla because this will increase the chance of the lady to develop lymphedema of the arm, which may end after many years into lymphangiosarcoma. So the exception here is D. Following are true for ductal carcinoma in situ. It is usually unilateral. Yes, that's true. Multifocal. No, this is untrue. This is the exception because multifocality is a feature of lobular carcinoma in situ, not DCIS. Excision with or without radiotherapy is the treatment of a choice. Yes. No role of chemotherapy. Yes. Because ductal carcinoma in situ, it is in situ. It doesn't breach the basement membrane. If it breaches the basement membrane, it can reach the lymphatics and the vasculature of the breast and can disseminate systematically, and in this situation it needs chemotherapy, but it is in situ, it doesn't need chemotherapy. What is the predictive value for benign disease when all three components of the triple assessment are benign? 72, 76, 82%, 92%, 99%. It is 99% if the triple assessment agree for a benign lesion. At what age would you choose to do a mammography of a breast lump as opposed to an ultrasound? Usually, you know that 35 years of age is the age below which you ask for ultrasound, and above it you can do mammography. So look for 35. Yes, go for B, 35 years of age. How many women will develop carcinoma in the breast during her lifetime? المعلومة دي انت عارفها هي 1 in 8 women. So look for 1 in 3, 1 in 5, 1 in 7, 1 in 9, 1 in 11. Go for 1 in 9. قريبة من 1 in 8. Okay? What percentage of breast cancer are sporadic? انت عارف المعلومة دي ان حوالي 75% من breast cancer are sporadic، يعني ما تقدرش تبقى relating it to hereditary causes. فمندور على الرقم ده هتلاقيه في دي 70%. اوكي، go for D. What is the age of routine screening mammography? البروجرام فور سكرينينج ماموجرافي من up to date بيبدأ من سن 40. go for C. 40 years من 40 ل 50 سنة بيتعمل كل سنة، وبداية من 50 سنة فما فوق بيتعمل كل سنتين. اوكي. go for C. بايرات score 4 suggest normal lesion ولا suspicion of malignancy ولا mostly benign ولا proven malignancy. go for B. it means suspicion of malignancy and the percentage of being malignant is about 20%. So this 20% is enough for the surgeon to go for biopsy, so long it is BIRAD 4. Okay. BIRAD score 5 is negative or probably benign or suspicious abnormality or highly suggestive of malignancy. It is highly suggestive of malignancy. go for D. And the probability to find the carcinoma about 90%. Here also you have to take biopsy. Okay. Risk of malignancy in BIRAD 2 is less than 2%. So go for A, 0 to 2%. Okay. So the recommendation for BIRAD 2 is to continue the routine annual mammogram. Okay. Radiation dose in mammography. Which of these؟ انت بتبقى حافظ ان الراديشن dose of mammography 0.1 centigrade per study. 0.1 centigrade per study. وهذا يمثل as if ان الست دي عملت 4 chest x-ray. Okay. go for C. Which of the following is seen in carcinoma breast? Macro calcification, popcorn calcification, nodular calcification, pleomorphic calcification. go for D, pleomorphic calcification. البابكورن calcification بنشوفه في الفايبرو ادينوما. اوكي. Bodorange appearance of the mammary scan is due to intraepithelial cancer or subepidermal cancer or lymphatic permeation or vascular embolization. go for lymphatic permeation. C. Most common site of metastasis from breast carcinoma to thoracic vertebrae or pelvis or femur or lumbar vertebrae. go for D, lumbar vertebrae. Okay. True about lymphatic spread of carcinoma of the breast. Axillary nodes are most commonly involved. Internal mammary nodes are also involved. If supraclavicular lymph nodes is involved, then it is N3. Axillary nodes are treated by surgical resection. All of the above. go for all of the above. All are true. Okay. Secondary deposits from carcinoma breast is commonest in lung, liver, brain, or bone. go for bone. Carcinoma of the breast give metastasis to bone very frequently. Okay. If someone inherits the BRCA1 or BRCA2 gene, which will their lifetime risk of breast cancer be؟ انت بتبقى حافظ ان حاملي BRCA1 or BRCA2 جين بيبقى عندهم 80% incidence of getting carcinoma usually before the age of 50. So go for E, 80%. Okay. What percentage of breast cancer are ductal? NOS, no specific type. You should know this by heart. It is about 80% are infiltrating ductal carcinoma, not otherwise specified. Okay? Or specific. 50-year-old postmenopausal woman on hormone replacement therapy present with heaviness in both breasts. Screening mammography reveals a high-density speculated mass with cluster of pleomorphic microcalcification and ipsilateral large axillary lymph nodes. The mass described here most likely represent go for carcinoma. It couldn't be cystosarcoma, phylloids, or lymphoma, or fibroadenoma. This is a description of adenocarcinoma of the breast. Okay? With reference to mammography, which one of the following statement is correct? A baseline study should be done for all women at age 30. It uses less radiation energy than chest X-ray. في واقع الأمر بيبقى أكتر، بيساوي 4 أضعاف الانرجي اللي بتستخدم في التشيست اكس راي. It should be part of regular follow-up of a woman following therapy for unilateral breast cancer. Yes, this is a correct statement. أي واحدة عملت عملية على الثدي، الناحية التانية لازم annually نعمل لها، على الناحيتين طبعا، نعمل لها ماموجرافي، especially هي لو كانت عاملة breast conserving surgery، عشان هدفين: عشان نتأكد ان الناحية اللي عملت عملية كلير ما فيهاش اي ريكارنس، وان الناحية الاوبزيت ما فيهاش اي نيولي ديفلوبد كارسينوما. جو فور سي. اوكي، العبارة دي بتقول it provides effective substitute for biopsy which is wrong. مفيش substitute for biopsy in diagnosing a lump of the breast. اوكي. Moderately increased risk for invasive breast carcinoma is associated with which of the following? Sclerosing adenoma, Bocrine metaplasia, ductectasia, atypical ductal hyperplasia, fibroadenoma. Go for D. atypical ductal hyperplasia مسؤول عن moderate increased risk to develop invasive breast carcinoma. Okay? Go for D. All of the following are predisposing factors for breast carcinoma except family history of breast carcinoma, first child at a younger age, early menarche and late menopause, nulliparous woman. Go for all of the following predisposing except first child at a younger age is protective. It does not predispose to breast cancer. The rest predispose. Okay? So first child at a younger age is not predisposing to breast carcinoma. Okay? All are risk factor for carcinoma breast except early menarche, late menopause, ovarian cancer, early full-term pregnancy. All are risk except D. D protects. Okay? Early full-term pregnancy before the age of 35. Percentage of malignancy in ductectasia is no risk. 15 to 1, 7 to 1, 10 to 1. Go for A. No risk. Ductectasia is not a risk factor to develop carcinoma of the breast. All of the following are used for reconstruction of the breast except transverse rectus abdominis mycutaneous flap, yes. Latissimus dorsi mycutaneous flap, yes. Pectoralis major mycutaneous flap, no. Pectoralis major mycutaneous flap is the exception. It is used to reconstruct face and neck after heroic surgery for carcinoma, but not for the breast. Okay? Transversus rectus abdominis free flap, yes. So in this question, the exception is C. In breast conservative surgery, the healthy margin excised is typically go for 1 centimeter. Okay? في بعض المراجع زي الاب تو ديت قال لك 5 ملي ممكن تشتغل برضو، بس احنا على مستوى الاندر جرادويت خلينا مع 1 سنتي. In the breast conserving therapy, which of the following investigation is required? Serum calcium, total body scan, sentinel node biopsy, tumor marker. بنحتاج C sentinel node biopsy واحنا بنعمل breast conserving therapy عشان نقرر إذا كانت الست دي هتحتاج axillary dissection or not. Okay? Go for C. 30-year-old female presented with unilateral breast cancer associated with axillary lymph node enlargement, modified radical mastectomy is done. Further treatment plan will be عملت باتي على ناحية وكان عندها lymph node enlargement. محتاجة هي بعد كده observation and follow up ولا Adriamycin based chemotherapy followed by tamoxifen depending on the estrogen progesterone receptor status ولا Adriamycin based chemotherapy only ولا tamoxifen only. طالما عندها lymph node positive في الأكزيلا تبقى هتحتاج adjuvant chemotherapy، يبقى لازم نديها Adriamycin. طيب هتحتاج تاموكسافين على حسب ال ER positive or negative. Go for B. In this question, go for B. Okay? Breast conservative surgery or conserving therapy is done in all except young patient ductal carcinoma and cytolobular carcinoma, infiltrative ductal carcinoma. The exception here is lobular carcinoma because lobular carcinoma is usually multicentric, multifocal. It is not a candidate for a breast conserving therapy. Okay, it is contraindication for breast conserving therapy. All right, lobular carcinoma. True about modified radical mastectomy is pectoralis major is removed. This is not true. We don't remove pectoralis major. الباقي هتلاقيه true. Axillary lymph nodes are preserved. This is not true. This is wrong also. Pectoralis minor is divided. Yes. In the true sentence here in modified radical mastectomy is pectoralis minor may be divided, even removed, to open the axilla for clearance of lymph node. دي هتلاقيها خطأ. Internal mammary lymph nodes are removed. Internal mammary lymph nodes is not removed in modified radical mastectomy. So the correct statement here is pectoralis minor is divided. The rest are wrong. Okay? Breast conserving therapy is indicated in tumor size أقل من 4 سم. Yes. Central. No. Lobular carcinoma. No. Pendulous breast. Relative contraindication. Relative. No. Diffuse macrocalcification. No. So, the correct statement here for breast conserving therapy is tumor size أقل من 4 سم. Go for A. In Baki modified mastectomy, which of the following is preserved? Look for and search for pectoralis major. Pectoralis major is intact in Baki modified mastectomy. Okay? Go for B. A patient underwent breast conserving therapy for a 3 centimeter lesion along with sentinel lymph node biopsy, which showed 1/3 of sentinel lymph nodes are positive for macrometastasis. Next step هتعمل ايه؟ completion axillary lymph node dissection, chemotherapy and radiotherapy ولا modified radical mastectomy with level 1 lymphadenectomy ولا modified radical with level 3 ولا only chemotherapy and radiotherapy. Go for A. طالما sentinel lymph node is positive, you have to complete axillary lymph node dissection and you have to give this lady post-operative adjuvant chemotherapy because lymph nodes in the axilla are involved, which means that the probability of distant systemic metastasis is high. Okay? And you have to give radiotherapy for the remaining breast because this is an important component of breast conserving therapy. Okay? Go for A. Drug used in estrogen-dependent breast cancer. Tamoxifen, clomiphene, estrogen, Adriamycin. Go for tamoxifen. Okay? Chronic treatment with tamoxifen can cause carcinoma of which? Look and search for endometrium. It can cause uterine carcinoma. Tamoxifen, that's why it is given for 5 years, but nowadays it is extended to 10 years, not 5 years. Okay? But of course, uh, endometrial carcinoma is a risk after using tamoxifen for long period. Okay, use of tamoxifen for breast cancer can cause all of the following adverse effects except thromboembolism, yes. Endometrial carcinoma, yes. Carcinoma in the contralateral breast, no. As a matter of fact, it is chemopreventive. Tamoxifen بيحمي السيدة ان يجيلها cancer on the opposite side. So the exception here is C. It can cause cataract. The exception here is C. BRCA1 positive women have what percentage increased risk of breast carcinoma? Go for 60%. Okay. Gale model of risk assessment is used for which cancer? Carcinoma of the breast. Go for C. Least risk of carcinoma breast is seen in BRCA1, BRCA2, Leframoni syndrome, familial adenomatous polypi. Go for D, familial adenomatous polypi. 45 years old woman present with a hard and mobile lump in the breast. Next investigation is go for mammography. Okay? A female patient present with hard mobile lump in her right breast. Which investigation would be most helpful in making the diagnosis? طالما سأل عن الدياجنوزس وليس الانفستيجيشن دور على biopsy. Go for true cut needle biopsy. ده أحسن حاجة هتساعدك في تشخيص اللمب. أوكي؟ إنما الفرونت لاين انفستيجيشن لللمب is mammography. Okay. 50-year-old female has undergone mastectomy for carcinoma of the breast. After mastectomy, the patient is not able to extend, adduct, and internally rotate the arm. الاكشن ده بتاع لاتيسماس دورساي. لاتيسماس دورساي هي اللي بتخليك تحرك الشولدر وانت بتعوم سباحة النوع اللي هو الحر الفري. واخد بالك؟ you extend the arm, adduct the arm, internally rotate the arm with latissimus dorsi. Now, which supply of the following muscle is damaged? To look for and search for latissimus dorsi. Go for C. Okay. 45-year-old female patient with family history of breast carcinoma showed diffuse microcalcification on mammography. Intraductal carcinoma in situ was seen on biopsy. Most appropriate management is عندها diffuse microcalcification. هترشحها للبي سي تي ولا راديكال ماستكتومي ولا سمبل ماستكتومي ولا كيمو ثيرابي. اوكي. طالما هي دكتال كارسينوما in situ و diffuse microcalcification, she is a candidate for simple mastectomy. Okay. Go for C. True about treatment of early breast cancer. Aromatase inhibitors are replacing tamoxifen in premenopausal women. دي عبارة خاطئة. في واقع الأمر التاموكسافين أحسن أوقاته، هو بيتاخد في كل الأوقات بس فعال قوي في البري مينوبوزال ومن عشان عندها أوفري شغال، والتاموكسافين أنتي استروجين. Post mastectomy radiation therapy is given when 4 or more lymph nodes are positive. دي حقيقة. لما الباثولوجي يقول لك 4 أو أكتر lymph node positive يبقى معناها الست دي محتاجة راديشن على السوبرا كلافيكولار والانترنال مامري ليمف نود بوست اوبراتيفلي. اوكي. دي الترو ستيتمنت، الباقي هتلاقيه فولس. تاموكسافين is not useful in postmenopausal women. في واقع الامر it is useful so long ان هي ER positive. In postmenopausal women multi-drug chemotherapy is contraindicated. دي عبارة خاطئة. مفيش contraindication so long the lady can tolerate. Okay. So in this question go for B. Which of the following statement is not true about tamoxifen? It is used for visceral metastasis. ممكن يستخدم، بس لو هو life threatening metastasis مثلا في الليفر الأحسن تستخدم الكيموثيرابي، لأن التاموكسافين بطيء في الأكشن. أوكي. Tamoxifen is useful in postmenopausal and aromatase inhibitors in premenopausal women. دي عبارة خاطئة، هو العكس الصحيح. في البوستومينوبوزال بنستخدم aromatase inhibitor، وفي البريمينوبوزال بنستخدم تاموكسافين. الدوز اوف تاموكسافين is 20 ملغ for 5 years. ممكن صح، وحاليا في بعض الدراسات ممكن تمده ل 10 سنوات. تاموكسافين كان كوز اندوميتريال كارسينوما. ده طبعا ترو. يبقى العبارة اللي هي نوت ترو هير اللي هي البي، اللي هي قصة العكس اللي هو عمله، حط تاموكسافين في البوستومينوبوزال وهو المفروض يتحط بريمينوبوزال. اوكي، جو فور بي. BRCA1 gene is associated with ductal carcinoma, lobular carcinoma, medullary carcinoma, colloid carcinoma. Go for A. It is associated with ductal carcinoma. Type of fibroadenosis most likely undergo malignant change is adenosis ولا epitheliosis ولا sclerosing adenosis ولا cystic type. Go for epitheliosis اللي هي فيها hyperplasia of the duct epithelium. فلما تبقى atypical هي دي أخطر نوع من أنواع الفايبروادينوزس اللي هو carry a risk factor for developing breast carcinoma. Go for B. BRCA1 gene is located in which chromosome؟ دور على 17. BRCA1 على 17، BRCA2 على 13. اوكي، go for C. Histological variety of breast carcinoma with best prognosis is search for tubular اللي هو حوالي 1 أو 2% carry the best prognosis. Breast cancer which is multicentric and bilateral, search for lobular carcinoma. It is the one B which is multicentric and bilateral. Okay. Single file pattern is seen in breast cancer type. Which one? It is infiltrating lobular carcinoma. Go for B. والسنجل فايل باترن بيشبهوه ميمك الهنود الحمر زمان اما كانوا بيجوا يحاربوا، كانوا يقفوا صف بالمنظر ده ورا بعض، واخد بالك؟ تحت الميكروسكوب الانفلتريتنج لوبولار كارسينوما الخلايا عامله صف اهو وصف تاني اهو يتخلل البريست كانسر، عشان كده الباترن ده سموه ايه؟ سنجل فايل باترن او انديان باترن. اوكي، go for infiltrating lobular. B. Triple assessment for carcinoma of the breast includes history, clinical examination mammogram, history, clinical examination fine needle, ultrasonography mammogram fine needle, clinical examination mammogram and fine needle. Go for D. Triple assessment for any lump of the breast should include clinical examination, imaging study, and biopsy. Okay? Go for D. Best diagnostic method for breast lump is بيتكلم على diagnosis مش investigation. So go for biopsy. C. Okay? The best diagnostic method for any breast lump is biopsy. Most sensitive imaging for ductal carcinoma on cyto of the breast is mammography ولا MRI ولا BET ولا ultrasonography. Go for MRI. Most sensitive for ductal carcinoma in situ. Okay. 45 years old postmenopausal lady presents with an 8 cm breast lump. 8 cm يبقى التي بتاعها ايه؟ التي 2 من 2 ل 5، التي 3 فوق 5، يبقى هي تي 3. اوكي. adherent to the skin. طالما قال لك adherent to the skin انت عارف any size adherent to the skin يبقى T4. يبقى T4. With one firm apical lymph node in the axilla and one more node in the ipsilateral supraclavicular area. ipsilateral تبقى N3C. اوكي؟ طالما هي supraclavicular. With no clinical evidence of distal metastasis يعني M0. The staging is يبقى ندور على حاجة بتبدأ ب T4. ادي هنا T4 و N3C علشان ده معناها ان ipsilateral supraclavicular is involved و M0 go for B N T3 N T4 sorry T4 N3C M0. Okay? In patient with breast cancer, chest wall involvement means involvement of any one of the following structure except. لما تقول ان في chest wall involvement فانت لا تتضمن البكتيراليس ميجور. بكتيراليس ميجور بي لا تعتبر من ضمن التشيست وول. المقصود بالتشيست وول serratus anterior intercostal muscles والريبس. انما لو just involvement of pectoralis major ما وصلش لاي واحد من ثلاثة دول يبقى لا يعتبر فيه chest wall involvement. ما تقدرش تقول عليها T4. اوكي؟ go for B. Carcinoma of the breast T4B involves all except T4A معناها ان هي involving الchest. T4B معناها ان هي involvement السكن. اوكي؟ T4B involvement of the skin. فهو بيقول لك involvement of the skin يتضمن كل الآتي ما عدا طبعا nipple retraction is not included في T4B إنما skin ulcer included, dermal edema البودورانج included معناها T4B, satellite nodule included إنما just retraction not included, dimpling not included, buckering not included. اوكي؟ فاوعى واحدة ست يبقى عندها dimpling او buckering او nipple retraction وتشخصها 2,4B. اوكي؟ انما اي واحدة من دول ممكن تبقى 2,4B. اوكي؟ Which of the following stage of breast cancer corresponds with following feature? Breast mass of 6 to 3 centimeter. 6 في 3 دي فبنركز على 6 اللي هو أكبر رقم يبقى دي T3 اللي هو فوق 5 سنتي. أوكي؟ hard mobile ipsilateral axillary lymph node and ipsilateral supraclavicular. طالما قال ipsilateral supraclavicular تبقى N3C. يبقى احنا بندور على حاجة في دول تبدأ ب T3 و N3 اللي هي دي يبقى T3 N3 M0 go for D. That's enough for this sitting. This is Dr. Saeed Abdelbaqi, Professor of General Surgery in Shamsi University. Thank you so much for watching this video. Now it's time to like, share and subscribe.